Okay, so today we're in the month of September and we are talking about suicide prevention awareness. And Doctor, if you could introduce yourself and talk about who you're with.
Thank you. I'm Dr. Muhammad Haqqani, Chief Medical Officer at Dallas Behavioral Healthcare Hospital.
Okay, and did a little bit of research. I don't know a lot, but 1 in 5 will experience mental illness within a year is
Yes.
the average, and that every year more than 46,000, 47,000
Somewhere on that.
die?
Yes.
Okay. Why? What is the underlying thing behind suicide? Why does it happen?
That's a very important question. About 50% of the patients who commit suicide have depression. And if you add alcohol and other drug problem to it, 70% of the patients who die from suicide are due to the problems with depression and alcoholism. So mental health problems, depression is probably the leading cause of suicide in most people.
Okay. And are there particular warning signs?
Yes, there are many warning signs for suicide. If somebody notices in patients change in behavior, loss of interest, lack of motivation, feeling of hopelessness, somebody talking about killing themselves or giving up their possession, or if they have a previous history of suicide or history of chemical addiction. If anybody in their family has attempted suicide or committed suicide, they put them at a higher risk of attempting suicide.
What's the reason behind that? Is there like a link, genetic link on that?
It's both. It's genetic link and also a learning behavior. And we have seen that after the suicides of celebrities and famous people, people try to copycat that, mimic that, and try to attempt that too. So if a close family member has committed suicide or a close friend has committed suicide, even though they are not biologically related, can increase the risk of attempting suicide in that person too.
Is it because of an issue that they already have that heightens that, or?
Of course,
Okay.
yeah. I mean, normal people, go through a lot of stress in their life, but there are certain factors that put them at a higher risk of suicide. So if they're already at a higher rate, a higher risk of suicide, any exposure of that kind of behavior will put them at a higher risk too.
And you talked earlier about ages. What are the age ranges?
Well, overall, if you look at the suicide rate in the United States, suicide is about the 10th leading cause of death in our country. But if you look at the age of 10 to 34, it's the second leading cause of death in that age population. So definitely an increasing trend in younger people, younger adults, and adolescent population. It's
Has
the
it
second.
always been that way, or is it just something that's?
It's increasing. It's increasing trend. If you look at the homicide rate, it's about half as much as about 19 to 20,000 people died from homicide, and more than double of that died from the suicide. Yeah.
Okay.
So unnatural death are usually the most common cause of death in young people, and suicide seems to be going at a higher rate.
Okay. So what do we do? As a society, how do we tackle this?
Well, prevention is the best way to go. I think there are certain factors that put the people to a higher risk of suicide. I think one of the common thing is the chemical and drug addiction, lack of family support, social support, lack of loss of social support network in younger people. I think those are probably one of the most common cause of suicide, and increasing depression due to certain reasons are also common cause of suicide.
So what do we do if we're faced with that now? Know someone. What's the answer?
Well, if you know someone that are developing any signs or symptoms of suicide, I think the best way to go is directly talk to them. And there's this big misconception about suicide among people, that if you ask directly about suicide to someone, and it will kind of introduce that idea in their mind. But that's not true. The studies have shown that if you directly ask about suicide, it does not increase the risk of suicide. Rather, it helps, opens the topic for a person to talk about that you already sort of acknowledge that, you
Right.
understand that, and you are willing to talk about that. So I think direct approach, directly talking, or asking a question like, are you feeling like killing yourself, would be the best way to go.
Okay. Now tell me a little bit about the facility we're in today.
Well, we are in the Dallas Behavioral Healthcare Hospital. It provides both acute and other forms of care, subacute care, which is outpatient, partial program, and IOP. It is a 116-bed hospital. It's a freestanding psychiatric hospital. It's a beautiful facility. I've been working here for a long time as a chief medical officer.
Okay. Well, thank you very much. We appreciate you taking the time today.
Thank you.